Why is Sinovac not recommended for health workers? Is it because of the 50% efficacy rate?
Sinovac becomes the third pharmaceutical company to be given by an emergency use authorization or EUA by our Food and Drug Administration. This means Sinovac's jabs may be already used in the government's vaccination program, but not yet for commercial use. FDA Director General Eric Domingo said that upon thorough review, they found that the China-made jab is safe to use. Its interim phase 3 data from ongoing trials in Brazil, Indonesia, and Turkey showed it has 65.3% to 91.2% efficacy. 2 doses will be given with a 4-week interval to individuals 18 to 59 years old and are clinically healthy. However, the vaccine is not recommended for healthcare workers. After a trial among health workers in Brazil showed it only has a 50.4% efficacy rate, Malacanang says it will revisit its prioritization list after the non-recommendation to health workers and senior citizens. Let's listen to FDA Director General Eric Domingo.
Yung safety profile niya is good. Yung mga adverse event po nito is mild to moderate. The usual po, no, na pananakit sa braso, konting sinat, at ang rating po niya ay maganda doon po sa allergy and anaphylaxis. Mababa po ang posibilidad na magkaroon ng allergy or yung severe allergy or anaphylaxis.
Palace spokesman Harry Roque said we did not sign an indemnification agreement with Sinovac, similar to what was asked by Pfizer. However, it will still be covered by the indemnification bill, which is being pushed in the Congress. Sean?
All right, Greg, for once and for all, do we know when these vaccines from Sinovac are arriving? Supposedly, the schedule was for tomorrow, February 23. Is this in any way delayed?
Sean, as of now, we don't have an exact date as to when will the 600,000 doses to be donated by Sinovac will arrive in the Philippines. However, Health Secretary Francisco Duque III said the Chinese embassy asked for 3 to 5 days for them to prepare the delivery of these doses. Sean?
All right, now with regard to that vaccine priority list, do we already have an idea on who will be first in line to receive the Sinovac shots instead of healthcare workers?
Since health workers and senior citizens are no longer part of the recommendation to receive this vaccine, according to Palace spokesman Harry Roque, the government would have to revisit our prioritization list, and we would have to wait for the revised prioritization list of the government. Sean?
All right, wait and see when it comes to that. One last question, Greg. Since there is already an EUA for Sinovac, will this mean that Sinovac's clinical trials will be pushing through here in the Philippines?
Sean, the Sinovac has been given an approval for the conduct of their phase 3 clinical trials in the country. Earlier today, we asked the Department of Science and Technology if the Sinovac will push through with their late-stage trials here in the Philippines. According to Dr. Jaime Montoya, Executive Director of the DOST PCHRD, the Sinovac's phase 3 trial will push through because they need to finish all their trials before they can apply for a certificate of product registration here in the Philippines for them to make their vaccines available in the market. Sean?
Thank you for answering all our questions. That was News 5's Greg Gregorio reporting to us live from Mandaluyong.